Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai. Welcome to Spectacle, your socio-political and economic program on Television Nigeria. I am Daniel Atai. Today, we will be looking into President Muhammadu Buhari's State of the Nation address on COVID-19 pandemic, with respect to the lockdown of some states, as well as the palliatives announced for the citizens of the country. I have two distinguished Nigerians on set today with me, and to help bring home the import of the contents of the presidential address. And you will be meeting them shortly after this timeout. Stay tuned.
Daddy! Daddy, you are welcome.
What? Daddy, you just came back from England.
So?
You have to be quarantined.
Quarantined?
Yes.
Okay, come and take my bag.
You and everything that came in with you from England have to be quarantined. If you travel out of the country and you come back, you stay on self-isolation for 14 days so that you don't infect other people. Perhaps there is anything of that virus in your system. If you do not discover any ailment, then you come back home and they will receive you like a family should.
Daddy,
Dad,
don't you love your father anymore?
don't you love your family anymore?
How? COVID-19.
It is real. It is real.
Thanks for staying tuned. The program is still Spectacle, and I have with me on set a distinguished Nigerian. He is an economist and also a politician of repute, the former presidential candidate of the ANRP. I'm talking about Tope Fashua.
Good afternoon. It's good to be here.
You're welcome to Spectacle.
Thank you very much.
And also on set is another noteworthy Nigerian, a public health specialist, Dr. Isaac Akuma Eboja. You are welcome to Spectacle, sir.
Good afternoon.
Good afternoon, sir. Now, before we continue the program, I would love us and the audience to have a look at the presidential address yesterday within this short minute, so we can take it up from there. Please stay tuned.
Curative measures in the event the disease hits Nigeria. The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis. Nigeria, unfortunately, confirmed its first case on 27 February 2020. Since then, we have seen the number of confirmed cases rise slowly. By the morning of March 29, 2020, the total confirmed cases within Nigeria has risen to 97. Regrettably, we also had our first fatality, a former employee of PPMC who died on 23rd March 2020. Our thoughts and prayers are with his family in these very difficult times. We also pray for quick recovery for those infected and undergoing treatment. As of today, COVID-19 has no cure. Scientists around the world are working very hard to develop a vaccine. We are in touch with these institutions as they work towards a solution that will be certified by international and local medical authorities within the shortest possible time. For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus. Since the outbreak was reported in China, our government has been monitoring the situation closely and studying the various responses adopted by other countries. Indeed, the Director General of the Nigerian Center for Disease Control was one of the 10 global health leaders invited by the World Health Organization to visit China and understudy their response approach. I am personally very proud of Dr. Ihekweazu for doing this on behalf of all Nigerians. Since his return, the NCDC has been implementing numerous strategies and programs in Nigeria to ensure that the adverse impact of this virus on our country is minimized. We ask all Nigerians to support the work the Federal Ministry of Health and NCDC are doing, led by the Presidential Task Force. Although we have adopted strategies used globally, our implementation programs have been tailored to reflect our local realities. In Nigeria, we are taking a two-step approach. First, to protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners to ensure their families get through this very difficult time in dignity and with hope and peace of mind. To date, we have introduced healthcare measures, border security, fiscal and monetary policies in our response. We shall continue to do so as
Welcome back. That was the presidential address yesterday by President Muhammadu Buhari about the COVID-19, and I believe you followed it diligently, and that is the matters arising that we want to discuss on Spectacle now. And like I said, the gentlemen are with me already. I will start with you, Mr. Tokwe Fashwa, being a candidate of a presidential candidate before. Did you see this address coming from the president, especially regarding the COVID-19 pandemic?
Well, we didn't see it coming, actually. That's the truth. Because for quite a while he wasn't speaking with the people, and there was some drama, some kind of drama around it. Why is he not speaking to the people? Some guy came, a very interesting guy called Imam of Peace or so on Twitter, and started to drag the president. I think the guy is from Iraq or somewhere, you know. And I think the next thing what we saw that the president took some pictures, and then there was this voiceless transmission by NTA where they showed him meeting with Ihekweazu and I think Minister Ehanire in the villa. They were briefing him. And then the next thing was we heard that he was going to come, at that point, whereas I don't believe that, I don't believe he probably needs to be talking to us as frequently as maybe President Trump or any of these other people. But at that point, I was also beginning to feel a bit frustrated that, okay, why isn't he speaking to Nigerians, even if it was just to assure Nigerians? A lot of people, God forbid, the anxiety of the moment and the fact that fear has been an ingredient, which I've even heard it justified even among experts, quote and unquote, that it is important to put fear in the people now. But the problem is that sometimes the fear will kill more people than the disease. And I felt, okay, it was important at that point for the president to speak with the people. And of course, he has spoken with the people. We hope the people are assured. He has taken some decisions. That's the way it's supposed to be. I mean, the speech of a president will not heal people of a disease. But just to let people know that, okay, a lot of people look up to the president. Not many people are self-led, if you like, Many people look up to the president as our leader, and so they want to hear from that. If you look at the UK, for example,
all right.
Boris Johnson,
Yeah.
he actually came out to say he has the
virus.
Yeah, that's the virus.
But before I go to Prof, what is your general overview of the presidential address? Just an overview.
It's okay. Well, number one is to say that it's timely. It covers maybe all the areas that we want it to cover to an extent. I didn't see provision for the poor and the people who don't have anything at all. The closest they got to that was to say people who had maybe borrowed money under the SIP or trader money and co. Should be given some moratorium not to repay. What we see in other nations that actually we say, okay, if you're not going to go out for 2 weeks, there are many ghettos around Abuja here, hundreds of ghettos. And if you want to lock these guys in, some people can't survive for more than 2 or 3 days on what they have. That's the truth. I mean, we have a big unemployment crisis on our hands. And even those who are employed, a lot of them are underemployed. Many companies don't even pay their people on time. So there's a crisis that we're hoping that hunger itself and starvation does not kill more people than the disease. So I didn't see it drilling down. I didn't see that specifics in those areas. Unlike what we've seen elsewhere, where in the US, $500 per child, $1,200 per worker. In the UK, provisions for the self-employed, £2,500 for each self-employed per month, which is 80%, estimated at 80% of what you would have ordinarily earned. That way you would see that, okay, the country actually, or the country, yes, and the president actually cares for the people. And I think it's a great opportunity, the time is still there, for the Nigerian government to seize this opportunity. Like they say, never waste a crisis. They can still seize the opportunity and show the people that they care. People have suggested you can reach out to the people through their BVNs. You can put some money in people's accounts. This is the time to do that. You can reach out to them. You can send them credit via their phones. We have the BVNs. We have the phone numbers and so on with the big MTN and Glo and all of this. And I think those are avenues that the government needs to explore at this moment.
All right, thank you very much. Prof, sir, the COVID-19, you were an expert in the public health. Could we say we have it in Nigeria now, as proclaimed by the National Center for Disease Control?
Certainly we do. If we don't, nobody will say that we do. We have the disease.
We have the disease in this country.
Yeah.
And the rate, the magnitude of death we record in Wuhan, Spain, Italy, and the United States of America. Just yesterday, you heard about 100 and died of the pandemic. This part of the world, what could be the difference why the death rate is low?
Well, let me make one correction. It wasn't even 100. In the US yesterday, it was 919 deaths.
Okay.
Okay. In Spain, it was about 700 and something. In Italy, I think they reported about 600 and something.
Just a day.
Just yesterday.
Just yesterday.
Just yesterday.
Yes.
Okay. What I would say, as far as Nigeria is concerned, is that so far we've been very lucky. So far we've been very lucky because it could be worse. And this is one of the reasons why the shutting down of the system, the transport system in particular, the airports, the seaports, is timely. In fact, if I'm sure we knew that it was going to be as bad as it is now, they would have, many countries, not just Nigeria, would have closed their doors long time ago. We are lucky. The cases we have right now in Nigeria is just almost 100, not quite 100 yet. As of yesterday, 97. That is not even up to the daily death rate of some countries.
Yeah.
And when you compare the population of those countries to our population, you know how lucky we've been. And the fact that Nigerians travel all over the place, and they're always going and coming. But let me explain what is going on around the world. First, people did not believe the seriousness of this pandemic as early as they should have.
Yes.
I'm referring to the question that you asked.
Yes. Whether
is this problem really here?
Yes.
It is not at this point that we would even ask that question.
Okay.
The question we should ask is, how severe is this problem? And what are we expecting? What are we supposed to look forward to? Is it that it is going to go away soon? Is it that it is going to be abated, or is it going to be escalating? What is the forecast?
No, we're coming to that.
Okay. So yes, it is true that we're in a very turbulent ride, and everybody is supposed to fasten his seatbelts. Let me explain something. The word fear here has two possible applications. First, don't fear in the sense that you are going to die today, or you are going to die, and therefore you are panicking. No, but fear for the fact that if you catch this virus, it could kill you. There are three words I would like to use. 1, hope. 2, caution and precaution. And 3, reasonable fear. I say reasonable fear because I do not know of anybody who would want to see fire and dip his or her hands into fire, or who would want to see a snake and go for the snake to bite the person, or see death coming and run towards death to hug it. There are not too many people who are normal that would do that, even if there are some. That means that we need to be cautious, we need to be careful, at the same time, we need to be confident that if we take the necessary precautions, we can go through this.
Doc, we know that, like you said, this disease, this virus is already in the country. What level of preparation has the National Center for for Disease Control and the panel constituted by the federal government, does it cut across all sectors and all states of the federation already to fighting or arresting this pandemic? Could you say something about that, sir?
Okay, there are two parts to your question. Part 1.
Yes.
What is the NCDC doing?
Yes.
Or what has it done?
No. What level of preparation are they now? Yes.
Okay.
And then the second one, the constitution of the panel for COVID-19 in the country. How does it cut across all sectors? And if it does, at the level of states, has it gotten to the local government level and to the primary health levels? So we want to know.
Okay. Now let me ask the first question. Answer the first question.
Yes, sir.
Right from the beginning of this pandemic, the Nigerian Center for Disease Control took action immediately. First, by training people and sending its staff to train those who are in the ports, beefing up the strength and the capacity of the people that work at the ports. That is what we call Port Health Authority. And there are personnel there manning them and manning the ports, whether you're talking of seaport or airport, it doesn't really matter. Okay, this staff had to be trained very quickly and had to be equipped with the necessary equipment with which to work and to protect themselves. That was done by NCDC very rapidly. Then secondly, those people who were coming from outside the country, especially, initially it was China that was a worry. Then very quickly we realized that it was not only China, the number of countries increased to 5, to 7, then to 13. And we all know all the 13 countries.
Yeah.
All of them right now have problems. The issue was anybody who is coming from this country should be screened. And after screening, should be educated, should be enlightened, should be instructed as to what to do to protect himself or herself and those around the person. And that's what has been going on, and it is still going on up to now. And this is one of the reasons why we've been able to detect the number of cases that we've been able to detect so far. Unfortunately, you cannot catch every situation and everybody. And the way this virus manifests is such that you may harbor it, but the clinical symptoms may not manifest immediately for you to know, even if it is within the incubation period. Let me refer to the first case that we had, the Italian guy that came to Nigeria. He was screened at the airport. He was okay. His temperature was normal. He had no symptoms. He didn't complain of any problem. And so therefore, there was no reason to quarantine him or to isolate him. However, a few days after, he started feeling unwell. And wisely, he went to a hospital to seek for help. And wisely, too, the doctors who attended to him were very smart, were very professional. They suspected that since he came from Italy, it could well be a case of coronavirus. And so they tested. And lo and behold, it was positive. These are measures that will help us catch those who either are already manifesting or are not yet manifesting but have been infected with the virus, especially if it is during the incubation period, which is between 1 and 14 days. Okay, so that probably answers your number one question.
Yeah.
Let me go to the number two question. The number two question was
the constitution.
Yes, of the presidential panel.
The panel, yeah,
yes.
constituted to fighting this.
Yes.
Does it cut across all sectors?
Yes.
You know the reason perhaps why I'm asking. There are some quarters where they said they have not seen them on ground, especially at the primary level of healthcare. And the villages, the locals, we know that some cities have been closed down. I will get to talk more on that. So what does it cut across the sectors, and how are they actually visibly doing this?
Okay, let me explain something. First of all, the constitution of the presidential panel does not have to cut across the entire country. In other words, it's not like the appointment of ministers that every state must have to have a minister. No. It cuts across those who have the expertise and relevant roles to play.
In the health sector.
In this issue.
Okay.
Let me explain something. The problem we have at hand does not only limit itself to health.
Okay.
There is economy involved
Yes.
in it. There is food security
Yes.
involved in it. There is politics,
Politics
which is what you are talking about.
and security.
Involved in it. There is security involved in it. But let me say something. From what I have seen, the Constitution, I do not know how it was arrived at, and I'm not in the position to defend or to analyze how the members were chosen. But I can tell you, from what I have seen, I think it is a good representation of the relevant stakeholders, actors that could play a role in helping us to solve the problem. Now, first of all, health in Nigeria is on concurrent list. What that means is, while the federal government sets policies and goals and guidelines, each state is at liberty to implement health programs at its own pace and to its own magnitude, to its own ability. And then when you go to the state then takes it further to the local governments. So don't expect that because something is done at the federal level, the same panel, presidential panel that is established at the federal level, would have to physically go to every state, go to every local government to act. No, that's not how it works. How it works is, whatever they are doing, it is replicating down to
at the
states.
state level,
yes,
and at the local
and at
government
the local
level.
government level. If it is a message, the message is going down to everybody, to the communities.
Okay.
That is the way it is supposed to be. It is not that you can never have a panel of any form
All right.
that will be that will be
Well encompassing and
then
equipped.
whose actions would physically, meaning that they are physically in every place. It is not possible.
Okay. Thank you,
But the
Prof.
effect of what they are doing is felt everywhere.
Okay. Okay, thank you, Prof, for that. I'll come back to you. I'm coming back to you now, Tokwe Fashua. You are an economist, and by virtue of your portfolio, I believe you can speak about the economic effect of this lockdown that the president ordered yesterday. 2 states, namely Lagos, FCT, and Ogun State, have been declared lockdown. First of all, does it have the constitutional power of doing that?
Well, I'm not a lawyer.
Okay.
I've heard lawyers say it doesn't have the constitutional authority. However, I lean more towards those who believe that there comes a time you suspend the Constitution.
Yeah.
In an emergency, if you actually do believe that it's worth the while. So I sway on the part of the president regarding that. However, when I look at the numbers, I think there are some stories that we're not telling the world, and it's a shame. As a matter of fact, as of this morning, the number is 111. They found 14 more people in Lagos.
Yes.
111 people, 1 death. A man that was actually, unfortunately, compromised by several cancers before he contracted this. And I'm wondering if it's going to be worthwhile, because this is not... what the president said was Lagos, Abuja, and
Ogun State.
Someone like Governor Fayemi in Ekiti had already locked down Ekiti.
Even River State has locked down.
So some of these guys, and I'm thinking, well, you're locking down, you're making no provisions for people.
Exactly.
The economy is 80% informal sector. These are civil, people who are taking decisions they are essentially civil servants who are earning money from the taxpayers' contribution. Whether you're a governor or you're the president, we're paying you every month. And some of us run SMEs, we run SMEs, we have to stay afloat whether we like it or not. We have to employ staff, we have to pay them.
Exactly.
There seems not to be any feeling towards that. It's very easy to just go to the rostrum and say this and that. And however, we look at the numbers, actually, if you challenge that number, well, one of the realities is that chances are that, of course, there are a lot more people who are infected in Nigeria because very few people have been tested. We see a certain scenario where it seems like it's the celebrities that are getting tested.
Okay.
That's why you see governors declaring El-Rufai, Bala Mohammed, Fahmy was negative. We see those kind of people. Then there's the EUCH, CMD. There's the immigration's Comptroller General. So, I mean, it's a case of, it's becoming like an elite disease.
Okay.
Where it's becoming,
perhaps because they've not tested the ordinary men.
It's becoming a class war.
Okay.
You're able to test those big men, and then they come, and it's becoming like a badge of honor. I have corona disease. I mean, in the same category as Prince Charles of Great Britain, Boris Johnson of Great Britain. It's becoming something to pose with. And we have also seen some young people in this country who are trying to use this to gain followership on Instagram and Twitter.
Imagine.
And then some guy says, look, I was sick, I called them, I didn't know how I was feeling, I called NCDC. You should know your own case, your own body in the first place. You should know your own health history. Every headache now cannot become a case of I'm calling the NCDC. Some people will end up going to that NCDC, whatever the isolation, to carry the one that they didn't have in the first place. It's becoming a big joke. Apart from this, when we look at this number, I say Nigeria is not telling the world really why this thing is low here. We are waiting for the story to be told to us, just like our history was written for us by the white man. We are not telling the world why we think that this is so. We have professors in this country. Nobody has commissioned any research whatsoever into COVID at the government level, whether the state governor or the federal government. Say, we have professors of virology, professors of epidemiology, professors of microbiology. We have professors.
Yeah.
Why is our own original research to say this is why this thing is not getting traction in this country? Let me tell you why. As an economist and econometrician, my theory in that regard is this: that of course there are chances that a lot of small people who have been interacted with, when you talk about contagion and dispersion, the fact that one person has a disease and comes into Nigeria, you'll be shocked how many people that they can get in touch with in a day, and how many people, it's like a geometric progression, that how many people that those who they have got in touch with can also get in touch with. Chances are that we probably have hundreds of thousands of people who are infected with this thing in Nigeria. All right, but then why are they not dying? So, number one, in India, there are about 600-700 people who are infected in the whole of India right now. When I read the case study of India, the truth is that they said part of their advantage is they actually do a lot of self-medication in India. Self-medication, is very bad. Doctors don't like to hear about it. But Nigeria happens to be a country where they are selling, antibacterial medicine in wheelbarrows in the market. Yes. Okay, NAFDAC runs around and tries to stop all of this. People walk into chemists and get medicines for things that you will never be able to get in the United States or in Europe. That has to be prescription medicine. The ease with which you get prescription medicine. Yeah. We're probably seeing a scenario where we're seeing the underbelly of how they manage health, some health issues in the in the Western world, the developed world, quote and unquote. They don't manage things like flu. They believe that it will come and go. And all of a sudden, perhaps they have actually allowed this thing to seep too much into their system. And by the time you're now rushing people to emergency centers where you're looking at ventilators, I believe that there's very few ventilators in Nigeria, and those ventilators seem to be reserved for the high and mighty. All right, so we need to be telling the world our own story. That chances are that our people, yes, are self-medicating on some of these things. Chances are that there are also local remedies that can stave off this thing. We had this huge argument about chloroquine or no chloroquine. This morning on this day, the front page of this day is that the NCDC has actually started, using hydrochloroquine and azithromycin to manage this issue. And that's where I don't agree at all with those who try to use fear. I think a medical doctor should know better than to use fear in managing any situation. Yeah, WHO people, they are full of medical doctors, right? Yeah. A medical doctor knows better than to use. Look, someone has a cancer and comes to you as a medical doctor. This cancer they kill person, The fact that he said this cancer can kill you is enough to kill that person. I think it is fraudulent on the part of those medical doctors who are using fear to drive this thing simply because they want to create a global scare. Yeah. So if you have 111, and let me also say that the projections have been mixed. People said that there will be 45 million people dead in Nigeria. Some guy said he's a medical doctor, works with WHO. Some audio message that went viral. Look, before 45 million people will die in Nigeria, you probably wait for 200 years. At this current rate, 111, let's say tomorrow it becomes 500, the next day it becomes 1,000, but hey, people are dying of this disease. So I think we need to change the rhetoric. I think these technocrats who are managing this thing were a bit more interested in the relevance that they will get. So it's a case of, look, we've been working in WHO, you guys have not listened to us, now you will know. That is why someone like Trump, criticize him or not, he's saying that, look, the American economy was not created to be shut down. that economy was not created to be shut down, that you guys in WHO and FDA who are slowing him down, that he wants to come back by Easter, max. And he said, no, you have to shut down the economy till June. Even the way Nigerian economy is going, they want to shut down the economy till June. Now tell me how our people, 80% of them, who need to feed on a daily basis, forget people who are drawing salaries. A lot of times people who draw salaries in this country and even all over the world seem not to understand what the real man on the street goes through to earn 200 naira.
All right. I will come back to you with this over-dependency on the WHO, especially when we have research professors in the country who are medical experts. After this short break, Doc, be preparing to, because we are still going to ask you certain medical questions here. We'll take a brief break now, and after the timeout, our guest in the studio will continue the analysis from the presidential address yesterday. Stay tuned. Welcome back. This is still Spectacle, and we are still addressing the presidential address yesterday by Muhammadu Buhari on the COVID-19 pandemic. And with me in the studio are still the gentleman, doctor, who is a prof, and the presidential candidate, a politician, economist, and a social analyst. Before we went to that short break, Doc, I was going to ask you that there has been provisions and facilities on ground, and then a lockdown has been declared. How do you think this lockdown for 2 weeks is going to be managed? Are there incentive from the CBN? We learned there has been incentive from the CBN, about 50 billion on the 16th of this month, and the day before yesterday, the government still issued directives. So several donors also donated billions, like Otedola, Dangote, and so on, Two-Face Dibia. A lot of them donated huge sums of money. How are they going to structure this money to be able to give palliative succor to those people who are just living on penury, especially in this lockdown? But you wanted to react to this statement.
Yeah, permit me to react to some of the points that my brother made.
Yes.
Okay, first of all, the president said for 2 weeks, Abuja, FCT, Lagos, and Ogun, okay, are going to shut down for 2 weeks.
2 weeks.
He has not said 6 months. And we should not speculate what the president has not said.
Even if it is 24 hours.
Even if it is going to be more than that, our president said 2 weeks. And we should understand 2 weeks to be 2 weeks. When that 2 weeks period elapses, and he decides, based on what the situation would be at that time, either to terminate or to extend, that would be his decision at that point. But for now, to speculate that...
But are there enough facilities on ground to handle the lockdown?
I'm coming.
Okay.
But to speculate that it is going to be for 6 months is not fair on the president.
Okay. No, I wasn't talking about president. I'm talking about...
Yes, but he was the one who gave the order.
Up to June.
He was the one who gave the order. He has not said it will be up to June. He said for 2 weeks, and we should understand 2 weeks to be 2 weeks. And let me say something too. Before that, we were talking about the constitutionality of the order. He is the commander-in-chief.
Okay.
He's the captain of the ship.
He doesn't need approval from the National Assembly?
If you think that's not the issue.
Okay.
Let me tell you something. Even if there's a need for war, for example, today, and the president by constitutional provision is supposed to take permission from the National Assembly, he being the commander can go ahead and give the order for the country to be defended while he is concurrently meeting or reaching out to the National Assembly for their own concurrence. That is being done. Okay. That has been done in many countries before, including America. Okay. So that's not the issue. When the president is given the power, the mandate to rule the country, he has some discretion to apply.
Okay, back to the question.
Now back to the question that you're asking. If you listen to the president's speech very well yesterday, he mentioned 25 very key points. And the issue of welfare, especially the state of the poor people, how they would manage through these 14 days, was well stated. And I'm sure the Minister of Humanitarian Affairs, who is also looking at the welfare of the citizens, is going to be coming out with more information for us. Let me tell you, Lagos State, for example, if you'll be watching the television, Lagos State has been packaging food to be distributed to local governments so that those foods could be shared to families.
I will come.
No, you asked me.
Yes,
you asked me if the decision is not going to affect people so radically.
Whether there have been enormous measures, facilities on ground. These facilities involve finances, food, mobilities.
This is exactly what I'm trying to explain.
Okay.
The president himself cannot come and hand over food to people. He has ministers, and he mentioned specific roles and things that are going to happen. If you listen carefully and go and read through the major points of his speech,
I have about 64 of them. Now, and I want Tokwe to react to that statement.
At certain key points, he said, "I have directed that."
Yes.
When he says, "I have directed," it means somebody is going to go ahead and act based on the president's.
Are you aware in his directive about the SIP? He said that vulnerable persons, especially vulnerable persons, and the categories of vulnerable persons, you know them already. The disabled persons, the pregnant women, and the children per se. We are talking about a total lockdown where people that partakes in small, medium enterprises will have to shut down, and the economic livelihood will be shut down for that period. Have there been palliative measure enough to give them succor? That is the point I'm asking.
I understand you very well, but let me make a point. We are at the point of life and death. What is the preference? That we are left to liberty and we die from the disease?
But there has been donors. Okay, I'll come back to you, Prof.
I'm coming.
Prof, Prof, don't worry, I'll come back to you.
Professor,
doctor, sir, I'll come back to you. They call you Prof. So I'm used to that.
That you have small knowledge doesn't mean you're a professor.
Okay. All right, Mr. Tokwe, if you look at, could you react to the question I asked Prof when he gave, I think he's trying to give us some political overview of that. But in reality, as an economist, could you...
in terms of provision for the poor?
Yes.
I thought I even said about that earlier on, that all I heard was the SIP beneficiaries.
Yeah, there has been this loan given to the CBN said they are releasing.
You know what? I mean,
50
look at
billion.
that. No, there's 3.5 trillion provision from CBN.
Okay.
But all of that is going to go to loans because CBN only deals with banks.
Yes.
So except you have, before you get a loan, you have to have an account, a company account. All right, you have to be manufacturing something or the other before you go to. You have to have collateral because they're not going to give you the loan for free. So that one is just, again, it's sounding elitist because It's about those who are, they're talking about pharmaceutical companies. They're why? Because
aviation.
There's some things that may blindside us. As I speak to you, the price of pure water has gone up by about 30% in this country. A bag of 1,000 naira is now 1,300. And it's climbing and it's getting scarce. Why?
Yes.
Because the pellets that they use to make the nylon bag, the polythene bag, that the water is poured inside is imported from China, and that's the pellet. And you know that global logistics are seized up as a result of this global frenzy. So goods are not even able to come. And of course, before you import something from China to this place, it takes about 30 days for the ship to get here. So have we thought about the water that our people will drink? The big man doesn't drink pure water. He drinks bottled water. All right, the poor man drinks the pure water. Now we're saying that in some parts of Lagos, you can't even find pure water anymore. Again, pharmaceuticals, and that's why the central bank is quickly financing pharmaceuticals. Because the first thing that happened when this thing became a pandemic was a place like India, they shut down all export of any kind of drug, medicine. So we realized that in Nigeria, before you know it, we may be running away from COVID-19, and then God forbid to go and run into the hands of 1,000 other diseases where our people cannot find ordinary fancy Panadol to buy in the market. Not talk of people who have high blood pressure, diabetic, and all of that. So you see, we need you see, two things I have a problem with. Number one, let me quickly say that when I was talking about June, I was talking about the recommendation by medical experts and WHO in the big countries of the world that are much affected, UK, US, and so on. And usually what I see is a scenario where in Nigeria here, we wait for them to take decision. We take the same decisions that they've taken. For example, social distancing, which is hardly working in Nigeria. You know what I'm saying? Yeah. So, but to a large extent, it's very important for us to tell our story. It's important for us to listen. If we say that we have local remedies to this COVID or local ways of treating ourselves, now is the time to tell the world that we have one or two things. Not to say that until WHO tells us what to do
all the time, FDA, and we have to depend on WHO all the time. And we don't even know, Doc, now, we don't even know the causes of this pandemic.
Let me come.
No, World Health has not come out emphatically to tell us that this COVID-19, this is the source of it. We heard Big talking about it in 2015, talking about a 5G network. And we don't know whether it is a biological or biochemical weapon or as from gamma ray. So what is actually happening and how, when is it going to be quelled? You will close with that.
Let me say something. There are many ways of interpreting a situation. Okay. But let me tell the story of the Nigerian situation. It's very key. Okay. I do not work in the Nigerian Center for Disease Control. Yeah. But I can tell you, those guys are doing an excellent job. Okay. Let me explain what is going on. Let me tell the story so that everybody will hear very well. Okay. Even before the first case came to Nigeria, the Nigerian Center for Disease Control started preparing. And one of the best methods that we have applied, and it is working for us, and we've been commended by WHO, is this issue of tracing. Either the contacts or those who have, in one way or another, may have been infected. When the first case, the index case in Nigeria was reported, what did the Center for Nigerian Disease do? They started looking for all those who had come in contact with this person, actively, diligently looking for them and checking them and testing them. This is one of the reasons why we were able to catch the devil before it caught us. If anybody says they don't know why we have a low rate up to this point, this is one of the reasons. This case tracing that we are doing, contact tracing that we are doing, is one of the best things that anybody could do. And let me say something. I'm a medical doctor, and all of us, every medical doctor is admitting to the fact that we are learning a lot from this new virus because it has not been in existence before.
And you don't know the cause?
We know the cause. It is a virus.
The virus has origin?
Yes.
And what is the origin?
The virus has origin in nature. We have bacteria. We have human beings.
Is this chemical or bio?
It's not chemical. It's not chemical. A virus is a virus. It's an organism. It's not a chemical. It's an organism. But let me explain something. Now, every country is learning from another country. Ours is not unique. And that we have a situation today, this social distancing we are doing, how did it come about? We have now suspected and even known in many communities, in many countries, that the easiest way of spreading it to other people or to non-suspecting people in the community is to have physical contact with them. Okay.
All right.
Therefore, let me finish. This is very key. When you distance yourself from them, like I am distanced from you now, you limit the possibility of me giving you or you giving me the virus.
Okay.
That is the Nigerian story. And the issue of whether we self-medicate or we don't self-medicate, that is not the issue right now. The issue is we have a case. We look for all those who have been in contact with that case. We isolate them, we test them, and we treat them. That's the approach we are using. And it is working for us. Now, let me make another point.
Okay, it is working.
It is working.
And
this is the reason why
people are getting healed, isn't it?
Yes. We have already discharged 3 people.
But the president
in
said that it has no cure. Does it have a cure now? Or are we expecting any vaccine?
The virus manifests, there are symptoms that a patient manifests.
Okay.
Okay. What we are treating are those symptoms that we see.
Okay.
That is not to say that you have got something that will kill the virus. If we have our way.
Okay, but you are expecting the country.
They are developing vaccines, they are working on vaccines, they are working on drugs. But as of now, those are not ready. That is not to mean that, for example, if I have headache, right, I may not know what it is causing the headache. But if I take paracetamol and my headache goes, you are not going to say, because my headache, I have not killed whatever caused my headache has not gone. You cannot say that.
Okay.
Now, let me say something that my friend said that is very key and is very important.
Okay.
Yes, it may now seem like it is a disease of the elite. That's not so. Let's look at it from the other perspective. And what is the other perspective? People like El Rufai, people like the governor of Bauchi, and others who have admitted, Boris Johnson, Charles, who have admitted publicly that they have tested positively to the disease. What are they doing? They are giving good example. This is the way to look at it. They are giving good example to others so that if you do have any of these symptoms, or if you have come in contact with these people, don't carry the stigma or the fear that because if I say that I have come in contact with these people, or if I say that I'm coughing or sneezing or I have fever or something, they might react negatively to me, therefore let me hide. No, don't hide. This is a good example that these public figures are showing that we should copy from. Let me also tell you one thing that
that's all
the DG, it's very important.
Yeah.
Very important. The DG of the Nigerian Center for Disease Control, when he went to China and he came back, he self-isolated for 14 days.
Okay.
I've spoken about this before and I'm repeating it because this is a good example to others.
Okay.
What is he saying? He's saying, I am the one in charge of Nigerian Center for Disease Control. I'm a medical doctor. I could handle myself. But I am not going to do that. I'm going to be self-exemplary. And he did that. He isolated himself. What is he teaching? Everybody else should do the same. The guy is walking around, he has no problem.
All right.
But supposing he didn't,
others could have contracted if he had it.
They couldn't have contracted because he doesn't have the disease.
If he had it.
But if he didn't give that example, people would say, okay, he came back from China. Why didn't he isolate himself?
Yes.
This is the point I'm trying to make.
All right.
That these public figures are saying, I have this problem. It's not because they think
they are being exemplary.
It's a status symbol. They are trying to tell you, please don't hide it. It is not a disease of the poor or of the rich. It is a disease of everybody.
All right. Thank you. Perhaps very soon it will not be disease of everybody. It will be eradicated.
It could affect everybody.
All right. Tope Fashua, your last word on this. What lesson do you think the government should learn from this outbreak and to further be proactive in the future?
Well, I think that the average African, right, especially the Nigerian, should actually develop some gumption, some liver, like we say it on the streets. The whole idea that we're so helpless, this helplessness has to disappear. We come, we say the white man stole our history, he stole our science, he stole our whatever. Given the opportunity, we are so dependent.
Honestly.
You know, if we cannot tell our story with this one, I don't know when we would have the opportunity to tell our
I
story.
have told the story.
Anyway, you know, so to the extent that, look, there's a reason why this thing is not a major issue for us yet, okay? And the chances are that if we could identify what those things are, we may even be able to stop other diseases that may come in the future, you know.
Yeah.
And I've also heard it said that this thing has come to stay. Because, again, we're not getting as much...
It has been established like HIV.
Yeah, something like that. That would flare up from time to time and all of that. Now, if it flares up next year, are we going to shut down the economy? So the point is that we can't take a decision that will... For example, what is in Ekiti that the FIME is shutting down Ekiti? Who is in Ekiti? The poor market women can't even trade, and you know, the children can't go to school. Why did they shut down the schools in northwest Nigeria? Where there's, you know, even that Bauchi is even in northeast. You know, why did they shut down the schools in northwest Nigeria? Because they didn't even have a plan to even teach those children anything. So they shut down the school like three weeks ago, when their own children are attending private schools that are still on, and they have exams, they have things that are scheduling.
You have 30 seconds.
So to a large extent, look, if there's any message, the lessons are still being learned. Let me also repeat, this thing, you know, contrary to what the president said, well, there's no cure. Usually there's no cure to viruses. Like you mentioned several times, all of us are carriers of the cold, normal flu virus. All right, it comes from time to time. Our body battles it. We take one or two things. The difference between us and them out there is that you can walk to that chemist and get the same azithromycin they are giving you now. You know, to prevent, because viruses in themselves, they just make you susceptible to other bacterial infections around you. All right, I've heard it said. Even all of us are having to go and study virology now. They said the human body is the one that actually generates a virus in reaction to
bacteria.
Pushing, you know, and yes, you know, and it has to pushing out, you know, some poisoning in the body. Nobody knows, but hey, all of us are. We have Google is our friend. You know, YouTube is our friend. As much information as you can get. If they say something will kill you, you are under obligation to first of all protect yourself with everything you have. All right, first and foremost. Don't give up, and don't crawl in the corner of your house and say until NCDC comes to pick you up. That's the part I don't understand about our people. The same NCDC are going to be overburdened. And you can't say that every headache you have is now COVID-19. Before COVID-19, there were other things. After COVID-19, other things will come. So I would want us to be able to stand up and say, hey, we also have some knowledge in this part. All right? Some knowledge in this part. And we don't... Unfortunately for us, many of the researches done in our universities, all of those researches, all of those projects, all of those theses, all of those dissertations, if you see where they dump them in the dustbin after 6 months.
Thank you.
So we probably would have a solution to this thing for the world, but we're not standing up for ourselves.
Honestly, Doctor, I think that is where we will stop for today. If we have the cause to call you again, I believe you will join us.
Last word, please.
Okay, a second, please.
Okay.
A second, just a second.
Well, let me say something. When and if the opportunity arises for research to be done, it will be done. But for now, we are working on defense so that we will survive. And I ask every Nigerian, comply with the instructions that are being given.
All right.
The instructions may change from day to day because everybody is learning.
Okay.
Every country has a peculiar approach, a peculiar situation.
All right.
What is working for us may not work for everybody. And let me lastly say, there are still about 20 countries around the world where nobody has had, or no case of coronavirus has been reported.
Okay.
So we here in Nigeria that have very low rate, like I said, first of all, we are lucky. Two, we are doing the correct thing by trying to limit the spread of the disease.
All right,
and we should continue with what we are doing.
Thank you. That has been Dr. Egboja, and Dr. Egboja is a public health expert, and Tokpe Fashua, an economist and a presidential candidate of the ANRP. On Spectacle today, they've dealt with the presidential address yesterday on COVID-19 pandemic. I hope you stay safe. Follow up the simple instructions. Wash your hands regularly with 90% sanitizers, alcoholic sanitizers, and also give a social distance wherever you are. Fortunately, we don't know how to manage that social distance, but I think we'll continue that. as we fight the pandemic. That's where Spectacle will stop today. I have been Daniel Atai, and thanks for watching. Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai.